Hello, welcome back to Health Talk. Have you ever noticed a strange symptom in your body and thought, it's probably nothing? Maybe unexplained tiredness, a small lump, or a cough that just doesn't go away. The truth is, our bodies often give us warning signals when something isn't right. And sometimes, those signals can appear months or even years before a serious illness is discovered. Now, this is very important to understand. Having these symptoms does not automatically mean you have cancer. Many common conditions can cause them too. But if these symptoms persist for weeks or keep getting worse, it's important to pay attention and speak with a healthcare professional. In today's video, we'll talk about 7 early warning signs of cancer that many people ignore, and why noticing them early could make a huge difference. Let's begin. The first warning sign is unexplained weight loss. Losing weight without trying might sound like good news to some people, but it can sometimes signal a deeper health issue. If you suddenly lose 10 pounds or more without changing your diet or exercise routine, it may be worth paying attention. Certain cancers can affect how your body uses energy and nutrients. Tumors may release substances that change metabolism, causing your body to burn calories faster than normal. This symptom is sometimes linked with cancers of the pancreas, stomach, lungs, or esophagus. Again, weight loss can happen for many reasons, including stress or hormonal changes. But if it happens quickly and without explanation, it's a good idea to check with a doctor. Everyone feels tired sometimes. Long workdays, lack of sleep, or stress can all cause fatigue. But cancer-related fatigue is different. It's often described as a deep exhaustion that doesn't improve with rest or sleep. You might wake up in the morning feeling just as tired as when you went to bed. This type of fatigue can happen because the body is using a lot of energy to fight abnormal cell growth, or because the cancer affects the production of healthy blood cells. Persistent fatigue is sometimes associated with cancers like leukemia or colon cancer, but it can also occur with many other conditions. The key thing to watch for is fatigue that lasts for weeks and interferes with daily life. Another warning sign people sometimes overlook is a lump or swelling anywhere in the body. Many lumps are harmless. They can be caused by infections, cysts, or benign growths. However, a lump that grows, feels hard, or doesn't go away should be checked by a healthcare professional. Some of the most common areas where lumps may appear include the breast, the neck, the armpit, the testicles. Early detection is extremely important, especially for cancers like breast cancer or lymphoma, where treatment is often more effective when the disease is found early. If you notice a new lump that persists for several weeks, don't ignore it. Have you ever had a cough that just wouldn't go away? Most coughs are caused by colds, allergies, or infections. But a cough that lasts longer than 3 weeks may need medical attention. A persistent cough, especially one that produces blood or chest pain, can sometimes be linked to lung-related conditions. Similarly, hoarseness or voice changes that last for several weeks might signal irritation or issues affecting the throat or vocal cords. In some cases, these symptoms can be associated with cancers of the lungs, throat, or thyroid. Again, most long-lasting coughs are not cancer, but it's important not to ignore symptoms that continue for a long time. Your skin can reveal a lot about your health. One important warning sign is changes in moles or skin spots. Dermatologists often recommend remembering the ABCD rule when checking moles. A. Asymmetry, one half doesn't match the other. B. Border, edges are irregular or blurred. C. Color, multiple colors or uneven color. D. Diameter, larger than about 6 mm. E. Evolving, the mole changes in size, shape, or color. New growths, sores that don't heal, or skin that becomes unusually dark or yellow should also be examined. Early detection of skin cancer greatly increases the chances of successful treatment. Another early warning sign can be changes in bowel or bladder habits. For example, persistent diarrhea or constipation, feeling like you still need to go after using the bathroom, blood in the stool or urine, pain during urination. These symptoms may be related to infections, diet changes, or digestive issues. However, long-term changes can sometimes be linked with cancers affecting the colon, bladder, or prostate. If these symptoms continue for more than a few weeks, it's important to seek medical advice. Pain is your body's way of telling you that something isn't right. While occasional aches are normal, persistent pain without a clear cause should never be ignored. For example, long-lasting back pain, persistent headaches, Ongoing abdominal pain. In some cases, pain occurs when a tumor presses on nerves or organs. However, many non-cancer conditions can also cause chronic pain, so the key factor is duration and severity. If pain continues for weeks and doesn't improve, it's best to get it evaluated. Our bodies are incredibly intelligent, and they often send signals when something isn't right. The 7 warning signs we discussed today are: unexplained weight loss, persistent fatigue, unusual lumps or swelling, long-lasting cough or hoarseness, changes in skin or moles, changes in bathroom habits, ongoing unexplained pain. Remember, having these symptoms doesn't necessarily mean cancer, but listening to your body and seeking medical advice when something feels unusual can make a big difference. Early detection saves lives. If you found this video helpful, consider liking the video, subscribing to Health Talk, and sharing it with someone who might benefit from this information. And as always, stay informed, stay healthy, and take care of your body.